Hi, I'm Marcy Williams. Welcome to Health Currents, which is sponsored by Atlanticare Medical Center. Our topic today is an interesting one, and I think while our focus may be on the women who could be affected by this new study, which is called the Breast Cancer Prevention Study, I think all of our viewers will gain some interest and some education about breast cancer and about this study. I'd like to introduce our guest today. Dr. Edward Braun is a physician oncologist who's involved with this study, and next to him is Joan Agritelis. Joan is the nurse oncologist who is coordinating the breast cancer prevention study. Before we start talking about the study, maybe we should talk a little bit about breast cancer, and maybe you can give us a little bit of information about the prevalence of this disease.
Well, breast cancer is a very common disease in this country, obviously the most common malignancy that affects women, and it affects about 150,000 women per year are newly diagnosed with breast cancer. And approximately 30,000 women per year in this country die of breast cancer. So as you can see, it's a major concern for the public and for the medical community, and it's a one of the major public health problems that we have facing us right at this moment.
And my understanding is it's also one of those diseases that if you get early diagnosis and treatment, it perhaps can be.
Well, it can be, because the natural history of breast cancer, which is something that's oftentimes poorly understood, is that before a woman feels a lump in her breast, or before her doctor feels a lump in the breast, that it may have been, or it has been growing probably about 6 to 8 years. And so there's a very long lead-in time before breast cancer is discovered. And when it's grown to that particular size, a certain number have spread to other parts of the body. If it can be detected early, then this hopefully can be detected before it's spread to other parts of the body, and the cure rate is much, much, much higher. The cure rate for breast cancer that's detected on a routine mammogram, for instance, in which nothing is felt, may approach 100%, so that one can see the advantage of having early detection of breast cancer.
Definitely. And help me understand, in light of what we know about breast cancer and what we're trying to do, or what people are trying to do with this study, what's the point of the study? Where did this idea come from?
Well, you know, there are different ways to approach the cancer problem. One is to treat cancer once it's developed and once the patient presents himself or herself, in this case obviously, to the medical community. Another is to try for early detection. And the third way, which would really be the best, would be to prevent cancer from occurring. And there are many programs in this country that already try to do this. For instance, the American Cancer Society and its program for smoking tries to prevent lung cancer. This is the first real attempt to try to prevent breast cancer.
Okay.
And that's the real importance of this study.
Okay.
And it's also the first major study ever to focus entirely on women.
Which is new,
Right.
isn't it? Okay. Okay. Joan, maybe you can tell us a little bit about how the study came about.
Well, we've been using tamoxifen to treat breast cancer for a long time. Tamoxifen actually is the most commonly prescribed medication in cancer care.
Okay.
And the thinking was, if we use it to treat existent breast cancer, can we give it to women who we know have a higher risk of developing breast cancer to prevent them from developing breast cancer in their lifetime?
Okay. And who's actually heading up the study? I know we meaning Atlanticare, is doing a piece of this.
This is overseen by the National Surgical Adjuvant Breast and Bowel Project, which is a national research group that has existed for over 30 years. It's sponsored by the National Institutes of Health and recommended by the American Cancer Society.
Okay. And how did Atlanticare get involved with deciding to do this kind of study?
We've had an ongoing affiliation with the NSABP.
I see. I see. Okay. And when was there a decision made that Atlanticare would actually sponsor this study?
Well, as I was driving down here today, no, we decided this several months ago, I believe. When we first heard of this study, it seems like such a great opportunity for us to participate in cancer prevention. We do so much for early detection and treatment. This is really an attempt to put the shoe on the other foot and prevent it. So as soon as we heard that this study was ongoing and it was looking for affiliated institutions, we called a university hospital, which is whom we work through, and we became involved with them right from the very beginning.
Okay, okay. And now I'm going to actually ask Joan a little bit about how one gets involved with this study. What actually happens to somebody who's interested in this?
The first step an individual should take is to call the hotline, which is at Union Hospital.
Okay.
The person who answers the phone will send that individual out the risk assessment form, which is the form that asks the questions that the computer needs to assess the individual's risk.
Now, Joan, anyone can get this form? Anyone who's interested?
Anyone can get the form.
Okay.
And filling out the form does not commit an individual to participating in the study.
Okay.
Okay? So the person who fills out the form sends it in the envelope that we provide to the national headquarters, which will feed the information into the computer, and the computer will assess the risk of the individual.
Okay.
The individual will then get a printed out sheet from the computer on her risk assessment.
So anyone who sends that in will receive some information?
Yes.
Okay.
Whether or not that person is eligible to participate in the study will be determined at that time also.
Okay.
Individuals who are not assessed to be at high enough risk to participate in the study will receive some information about the current recommendations for follow-up.
Okay.
The mammograms and the yearly exams and the monthly self-breast exams.
Okay.
Individuals that are assessed at high enough risk to be eligible for the study will then be contacted, and we will, talk to them about whether or not they want to participate in the study or not.
Okay. What is the eligibility?
Well, no one who's under 35 can be eligible. Okay. Now, what the computer assesses is the risk of any 60-year-old woman. So any woman who's 60 years old or older is automatically eligible just by her age.
Because, help me understand why.
Because we know that breast cancer occurs most commonly in women who are older.
Okay.
Okay.
Yeah.
The other risk factors that are assessed by the form are first-degree relatives, which are mothers, sisters, daughters.
Okay.
So individuals who have a mother or a sister or a daughter who we know has breast cancer have a higher risk. Women who started their period after the age of 14, because that is another risk form. Women who had their children after age 30, or women who never had children.
Okay. Now, all of these risk factors would actually be risk factors for breast cancer.
Right.
Right, but that also makes them more eligible for this study.
Right.
Thank you. Okay. Any others?
Those are actually the major areas that the risk assessment form looks at.
Okay. Okay. And Dr. Braun, would anybody who's interested, I shouldn't really be saying anybody, I should be saying any woman who's interested, would they need to talk over their interest with their physician, or can they automatically do this on their own?
No, the primary physician or the woman's physician, the woman needs a physician to participate in this study.
Okay.
Because yearly physical examinations are required, collecting certain laboratory data is required, doing chest x-rays every once in a while, doing mammograms or breast x-rays on a yearly basis is required. But this is not something extraordinary. As a woman should be participating in her health care in any case and should be doing these things. So yes, you just can't enter the study by yourself. One has to participate through the general health care system.
Okay. And when it comes to actually being part of the study, Dr. Braun spent some time talking about some of the tests that are required for this study. Those tests will not happen at Union Hospital. That's my understanding, right?
Well, they would happen wherever the woman happens to get these tests on a routine basis.
Okay.
Union Hospital is the participating institution. For most women in this area, I suppose they may get their tests either through Union Hospital or through laboratories connected with Union Hospital. But no, one gets the laboratory tests and the x-rays where she would normally get these things.
Then how do you, as coordinators of this study, get the data from the tests that these women have gone through?
Joan is going to fill out a lot of forms.
Okay, yeah?
We fill out a lot of forms, basically. We ask the person's primary care physician to provide us copies of the information that he accrues from these tests.
Okay. Now, Joan, you've mentioned the medication, tamoxifen. Most people want to know a little bit more about this medication. Is there a reason to worry? Is it one of those medications that has a lot of side effects?
Well, you know, any medication can have side effects. People die from Tylenol all the time. A lot of people have taken tamoxifen who already have breast cancer. So we use it to block the estrogen that could potentially stimulate tumor growth. Like any medication, it can have side effects. The most common side effects that it has are menopausal type symptoms. It can cause menopausal symptoms in women, hot flashes. And within this study is a protocol for managing menopausal type symptoms.
Okay. And now my worry would then be, okay, I'm going to take the tamoxifen. Does that mean if I come down with these symptoms, I'm then going to have to take another medication to manage those symptoms?
Well, within this protocol for managing these menopausal symptoms is the use of vitamin E.
Okay.
So a woman may be asked to take vitamin E if her menopausal symptoms caused by the medication are that bothersome to her.
Okay. And Dr. Braun, would you like to add anything more about the medication?
Well, I think we're all somewhat frightened about taking medication. I don't like to take medication. I mean, I suppose there are some people that do, but most of us are somewhat leery about taking medication. The use of tamoxifen in this was really discovered as an accident because women were being treated that had breast cancer established in other parts of the body, and tamoxifen was developed as a treatment for what we call metastatic breast cancer. And it was then noticed that these women who actually had a higher than usual risk of developing cancer in the other breast were developing cancer in that breast less frequently than was expected. So the fact that this drug has gotten to this particular point was sort of an accidental observance of the drug. It does have side effects. I mean, there are thousands of women now in this area and hundreds of thousands in this country that are taking tamoxifen. And it does cause the symptoms that Joan describes because it does have properties of estrogen and it does have properties of an anti-estrogen. But with any medication, we always have to balance the side effects of the medication versus the expected benefits. When we take penicillin for pneumonia, we actually make that decision. When we take a medication for anything, we try to weigh the risks versus the benefits to be derived from the medication. So although there are side effects, as Joan has mentioned, from this medicine, we feel that the benefits to be derived outweigh the risks from the medication. That always has to be kept in mind.
Okay. Joan, can you tell me a little bit about the length of time one makes to this study? Is it a long commitment? Is it a short commitment?
It's a long commitment, actually. The commitment is probably a minimum of 5 years. A maximum of 10 years.
Okay.
Because we are looking at women who potentially could develop breast cancer, we need to follow them for a long period of time because we don't know exactly when they would or may develop breast cancer. So it is a long commitment.
Okay. And to be part of this study, does one need to have health insurance? I mean, Dr. Braun has clearly said that you need to have a physician. That would then lead me to believe that you also need your own health coverage.
There are no funds available from the breast cancer study group to support the tests that are necessary to be in this program. So that one is, the woman who participates is responsible for the costs involved. And so there are certain laboratory tests that have to be done. There's chest x-rays, mammograms. For most women, their health insurance will cover this. But it really depends upon the insurance company per se and its attitude towards this particular kind of study. But most insurance companies now that term themselves HMO, or health maintenance organizations, this is really something that has their wholehearted support, because if there's anything that ever was health maintenance,
This is it.
this is it.
In addition to that, my understanding from you is many of the tests that you'd have to go through are similar to the tests that you would normally expect to go through if you're taking care of yourself in a given
Correct,
year,
yes.
right?
Yes.
Okay.
Yes,
Okay.
but there are certain women who may be eligible for this study that don't have any insurance at all. And the Union Hospital has agreed to financially bear the responsibility for the tests that are necessary for women in this area who don't have health insurance and who become eligible for the study. That is, they have to apply for the study, fill out all the forms, go to the classes, sign the consent form, and understand. But if they don't have any insurance at all, the Union Hospital will provide the laboratory tests and the x-rays. And Dr. Weinger, who's my associate, and myself will provide the physician services.
Now, that's a very unusual stance for one to take, especially a hospital to take at this time. Hospitals, if anything, are being very sure to not provide services where they can't count on an income. So help me with why all of a sudden Atlanticare has come up with what I think is an innovative
Well, I think you
idea.
suggested it, Marcy. No, when we were talking about this before, I think
And
you did.
Atlanticare thought I had a good idea.
It's coming out of your
You
paycheck.
said, you said, well, how are women who don't have health insurance going to pay for this? And that's actually the first time we had ever thought of that question.
Oh,
and we
I'm glad.
and we thought that it was a shame that a study is being run by the government, the National Institutes of Health, and no provision is made for the patients or the women who may not have health insurance. So your idea led to another, and I spoke to Mr. Andy Riddell, who's the CEO of Union Hospital, and he agreed to do this. And I spoke
Did you
to
tell him it was my idea? I'm playing.
He may, if this gets broadcast,
You'll see it. Okay. All right. All right. All right. Thanks. And I'm a little embarrassed. Okay. Can you talk a little bit about the women who actually are sort of on the borderline? They know they need to do something about this. They may have actually gone so far as to fill in the report, the questionnaire, and they may have received some information, but they're not so sure. And Joan, as a woman, I know this is something that we all sort of have to deal with on some level. That's why I didn't ask Dr. Braun this question. How do you decide?
I have a wife.
Oh, that's true. That's true.
daughter, yeah.
That's true.
All of these women know or suspect by contacting us and filling out these forms that they may be at a higher risk for developing breast cancer. I think this is every woman's nightmare, honestly. And these women at least will be afforded the benefit of counseling as to what their risk factors are as assessed by the computer, an impartial entity, as well as being counseled on what the most up-to-date screening methods and early detection methods are. And also encouraged to talk with her personal physician about her feelings on whether or not she should participate in this study. Obviously, we feel that this is a study that's worthwhile. And women who are at a high enough risk at a young age to have that risk of a 60-year-old woman may, in the long run, prevent themselves from developing a breast cancer if they do become placed on the tamoxifen, or provide us with enough information from their follow-up so that we can prevent other women from having to face this dilemma.
It's not so simple, because one thing that we really perhaps didn't mention or emphasize is that when one is accepted into this study and goes through the paperwork and understanding what it's about, one is not assured, the woman is not assured of being placed on tamoxifen. The goal of the study is to gather 16,000 women, and half of whom will be receiving placebo, that is an inert substance, and half of whom will be receiving tamoxifen.
So you really don't know.
You don't know. The patient doesn't know.
Okay.
The doctor, the personal physician doesn't know. Neither Joan nor I will know.
So for 5 years you could be taking
For 5 years, you could be taking a placebo.
Right.
Okay. Okay.
So that it's not so easy just to understand and say, well, I think I'll take tamoxifen and participate in this study. This is the kind of study that requires a great deal of thought to participate and commitment, but it's only through this kind of work that the answer to the question, that is, does tamoxifen prevent breast cancer, that the answer will ever be known.
Okay.
And it's through studies like this that women are now given the option of having a lumpectomy as opposed to having a mastectomy. These are the kind of studies that gave us the information that led to that change in what women were offered.
So ultimately, it's going to be beneficial for the future, for all of us probably.
Either we'll know that tamoxifen does prevent breast cancer, is useful in that purpose, or it doesn't.
Okay. Okay. Dr. Braun, as Joan and I were talking about what a woman should do to help themselves decide, you very quickly reminded us that you have a wife and a daughter. As a family member, is this something you think other men will be dealing with? What's the best way to kind of handle their concerns, their questions?
And the husband's concern?
Yeah, yeah.
It's such a difficult decision. I suspect that most husbands will gladly leave this decision to their wives.
Okay.
I mean, it's a very, very difficult decision to make. It would be easier decision to make if one just took tamoxifen or didn't take tamoxifen. But to participate in a study in which you may or may not be taking tamoxifen, and you don't know which one you're taking, I mean, unless you have side effects, of course, and in which you commit yourself to 5 years of study, and then 3 years afterwards of not taking anything, that is, no hormone replacement, in order to allow the data to accumulate. It's a very difficult decision to make. So I think that most, I don't want to speak for the husbands of America, but I suspect they may be leaving this decision to their wives.
Okay. Now, for those husbands or men who are involved with women who are considering this, if they have questions, can they also ask the program?
Certainly.
Okay. Okay, and you wouldn't mind answering any general questions that people have?
Not at all.
No, there will be sessions. That is, if people fill out the forms and send them in, and then they become eligible to participate in the study. There's still no commitment yet made on the woman's part. She then will have the opportunity to attend informational sessions that Joan will hold, and she will go into more detail about this, the risks and so forth and so on. So there'll be plenty of opportunity for women to discuss this with other women and to ask questions, then to go back to their own physicians if they wish to, and there'll be no pressure for anybody, and there's no commitment made until you actually sign on the dotted line. I suppose you can always stop anytime you want, but obviously the data will never be accumulated unless people participate in the study.
There's no money exchange for participation, is there?
No.
No.
No. Okay. Okay. And other than the actual data, or maybe I should ask, anybody who's part of the study, will they get the actual finished report? I mean, how will they know what the study is saying?
Oh, they'll just have to read the newspaper.
Okay. Generally, that's how people will.
In the newspaper. We've talked about side effects, and there's two other things that I wanted to mention, if you don't mind, is that there's two side effects of tamoxifen that may be very beneficial. Joan has talked about the menopausal symptoms, but there is evidence that tamoxifen will reduce the rate of osteoporosis, or the loss of calcium from the bone. And this is a very common problem amongst women.
Sure.
And tamoxifen may play a role in reducing the risk from osteoporosis, and also in reducing the risk of heart disease. So there may be extra added benefits other than the reduction in the breast cancer risk. So data will be collected along these same lines on the women who are participating.
So then, Dr. Braun, help me. Why wouldn't a woman decide, let me just go to my physician, let me request tamoxifen, and let me see for myself?
Well, to tell you the truth, the physicians can only prescribe medications based upon FDA recommendations. And the FDA has not recommended that tamoxifen be given to women to prevent the risk of breast cancer. So by doing that, the physician really flouts the law to some extent.
Okay. So it would not be advisable, I mean, for any physician to really...
I doubt it, because if the woman has a side effect, if the patient has a side effect from tamoxifen, and the physician has prescribed the drug for a non-prescribed indication, you know, you're really playing with fire under those circumstances.
Is Atlanticare the only facility in this area doing this study, or are
No,
there
I think
others?
most of the local hospitals are
doing this study.
Yeah.
Okay, sounds good. Now, here's a question for either one of you. It's a little bit about the controversy of doing this kind of study, and certainly, as Joan has said, this is perhaps one of the first with the focus on women. Right. I worry about, or wonder about, some of the reaction of some of the women's groups. Do they have any reaction to any of this?
Well, there is one group that did contact a local newspaper who contacted us and did a story that is concerned about giving possibly a medication to otherwise healthy people. But I guess my reaction is, if we don't give it to healthy people, we'll never know whether or not this can prevent breast cancer, because the whole focus of prevention is you need to get people who don't already have the disease.
But it's not otherwise. It's not just otherwise healthy. If the 150,000 women are going to be diagnosed as having breast cancer in 1993, and the lag time before that diagnosis is 6 to 8 years, now we have 8 times 150,000 women in this country who have breast cancer, but it not yet has come to diagnosis. And there are untold numbers, more than those, who have the genetic changes or whatever it is that leads to breast cancer. So we're not just dealing with otherwise, you know, healthy women that are otherwise, you know, have no particular problem. There's a large reservoir of women in this country who are going to be diagnosed with breast cancer, or who have the genetic changes that will someday lead to this diagnosis. So I don't really think that argument is terribly valid, personally.
But and we're not enrolling women on the study who don't have a high risk of potentially developing breast cancer.
Except that, but any woman 60 years of age or older is eligible for the study, whether they have first-degree relatives or any of the other factors that Joan has mentioned. And that age is picked because the incidence rate is about 350 per 100,000 women who are age 60 will have breast cancer diagnosis during that particular age. And it only goes up slightly more than that as one gets older. So that's why that particular age was chosen.
Okay. And for general questions, people can give a call, and if anything, ask even the silliest question, I'm assuming, is a question that's worth answering?
Yes.
Okay. And I'm assuming the phone number is underneath me right now as I talk. So for those of you who have questions, please be sure to use the phone number and call Dr. Braun and Joan Agritelis. With them having given such good information, I want to thank you for being here.
Thank you.
Thank you. Thank you for inviting us.
Thanks. And I want to thank you for joining us, and I'll see you next time. Bye.
That went by fast.
It sure did.